Welcome back, my people. We are getting into our second part of treatment methods or modalities for hemorrhoids. But before I continue, guys, let's continue subscribing, sharing, liking our videos so that they may reach as many people as possible. And if you subscribe, don't forget to put the notification bell on so that when we post any video, YouTube will automatically notify you, and through this you will never be left behind. We are still talking about treatment modalities for hemorrhoids. So there is a point to note. Hemorrhoid symptoms go away within a week. Hemorrhoid symptoms go away within a week after applying the home remedies. So see your doctor in a week if you don't get relief, or sooner if you have severe pain or bleeding. This means that after applying the home remedies, the symptoms must clear within 1 week, and if they doesn't clear, see your doctor if you have severe pain or bleeding. Getting back to the medications, in this part of medication, if you have hemorrhoids, if you have hemorrhoids and the hemorrhoids produce mild discomfort, your doctor might suggest an over-the-counter creams and suppositories and ointments, all pads which contain ingredients such as with hazel, whole hydrocortisone and lignocaine, which temporarily, not permanently, they temporarily relieve pain and itching. A point to note: don't use over-the-counter cream for more than a week unless your doctor has directed you to do so, because it can thin your skin. Remember, for example, hydrocortisone is an anti-inflammatory. So if you use it unnecessarily, it will have a negative impact on your body, that is thinning your skin. So let's talk about external hemorrhoid thrombectomy. External hemorrhoid thrombectomy. If a painful blood clot or thrombosis has formed within an internal hemorrhoid, your doctor can remove the hemorrhoid, which can provide prompt relief through a procedure called external hemorrhoid thrombectomy. Minimally invasive procedures for persistent bleeding or painful hemorrhoids. Doctor, in minimally invasive procedures for persistent bleeding or painful hemorrhoids, your doctor might recommend one of the other minimal invasive procedures available. Invasive means it doesn't involve any procedure like having a major surgery. So your doctor might suggest the following procedures, which are non-invasive, and we call them minimally invasive procedures. Number 1, rubber band ligation. Rubber band ligation. And doctor places 1 or 2 tiny rubber bands around the base of an internal hemorrhoid to cut off blood circulation. And if the blood circulation is cut, the hemorrhoid withers and falls off in a week. Here, the doctor uses a rubber band. Let's assume this is the hemorrhoid. So, the doctor will ligate or tie the hemorrhoid tightly at the base. This is aimed as cutting off the blood supply to the entire hemorrhoid. So, if the hemorrhoid blood supply is cut, the hemorrhoid withers and falls off within a week because it's not getting any nourishment, which includes oxygen and nutrients. So, hemorrhoid bleeding can be uncomfortable. Hemorrhoid bleeding can be uncomfortable and cause bleeding which might begin 2 to 4 days after the procedure. After ligation, you might have minimal bleeding within 2 to 4 days after the procedure. It's just minimal and it clears away by itself. B, or the second non-invasive procedure is what we call injection with a drug called sclerotherapy. Injection into brackets sclerotherapy. The doctor injects a chemical solution into the hemorrhoid tissue to shrink it. The doctor injects a chemical solution into the hemorrhoid to shrink it or to make it shrink. While the injection causes little or no pain, it might be less effective than rubber ligation. This means rubber ligation is more effective. Number 3, we have what we call coagulation. Coagulation or infrared laser or bipolar. Coagulation into brackets infrared laser or bipolar. Coagulation techniques use laser or infrared light or heat. So here heat is involved. So if heat is involved, it causes small bleeding and internal hemorrhoids to harden and shrivel. So the hemorrhoids harden because of the heat. The hemorrhoids harden, internal hemorrhoids harden and shrivel. Coagulation has few side effects. It has few side effects and causes little or no discomfort. This marks the end of our discussion today, and in our next video about medication, we will be discussing about surgical procedures which can be required in case the treatment or the home remedies and all these other non-invasive procedures are not successful. So the final phase or the last option when all the other non-invasive treatment modalities is not successful, we always suggest a client to go for a surgery. So in our next video, we will be discussing about the available surgical procedures which can be used to eradicate or to do away with hemorrhoids. So let's continue keeping the support on. Let's continue subscribing, sharing and liking our videos so that they may reach as many people. Guys, thank you for your time. Thank you for being with me. Thank you for being part of my family, and I hope we are getting sufficient knowledge in our day-to-day discussions. Have a good evening.